We're not only, of course, dependent on foreign companies for medications, vaccines, but critical medical supplies as well. And now there are new concerns about whether there will be enough supplies to help control the spread of the swine flu. There are already mass shortages all around this country, and most of those masks are made, of course, overseas. Inez Foray with our report.
The CDC recommends using N95 respirators and other masks for dealing with swine flu patients. It recently recognized there is a shortage of respiratory protection, but won't estimate by how much. One manufacturer estimates that at least 50% of the respirators for H1N1 swine flu are made in China. When it comes to surgical masks, 90% are made abroad in countries like Mexico, China, and Thailand. One U.S. mask manufacturer says too much production is now overseas.
If there's a pandemic, America won't be able to supply its own needs because we're pretty much it. And all the other manufacturers have left the country. We think that China will probably, at some point, if this gets worse, we think that China will probably keep their products for themselves.
The American Nurses Association says some of their nurses have already reported shortages of approved masks in some locations.
This has been something that has been in pandemic planning for several years, and an N95 is the minimal protection that we would need. So we're falling short already. It's very concerning because we want to see that nurses are protected on the job.
In 2007, the Department of Health and Human Services predicted that if we were to have a 1918-like pandemic, there would be a shortage of respiratory protection. In that scenario, HHS said America would need 5.3 billion respirators and 26.9 billion surgical masks, far more than the number currently in stockpiles. And the CDC predicts a large gap between supply and demand of respiratory equipment and is telling healthcare workers to stretch their supply. Now, some hospitals are asking nurses to use one mask per shift unless it gets wet or contaminated. Normal procedure is to change it with each new patient, Lou.
This is remarkable. What we are witnessing just in the last 5 minutes of your reporting and Kitty's. This is a nation right now that's not prepared for a pandemic. This is a nation whose primary public health agencies, which last spring and late winter, were sending masks to Mexico to help with their outbreak. We now are a nation with critical shortages, and we're supposed to be the advanced nation that has very sophisticated public health agencies and sophisticated planning, and obviously there are shortfalls.
And the manufacturers are telling me that they're slammed. I mean, they're saying they're working round the clock.
Again, this country has allowed two things to happen. One is we have over 20% of the pharmaceutical companies that we once did in this country. We're now dependent on foreign manufacturers for pharmaceutical companies, and we're reliant upon China and other producers for necessary medical equipment. It's crazy. All right, Kitty, thank you very much. Thank you very much, Inez.